let us understand what are the risk factors for people to get this cerebrovascular accident, because we have to know, as a homeopathic physician or as a physician, first of all, we should know what are the various web of causation according to PSM or preventive and social medicine, because if you make these correction, the possibility of the person progressing with a particular disease is also reduced or slowed down. So something which is non-modifiable, first of all, is the age. As the age progresses, it is seen that the atherosclerotic changes and the vessel degeneration begins, and this leads to a cerebrovascular pathology. Gender, it is usually seen in both men and women, but it is seen that if a woman lands up with a cerebrovascular accident, the chances of her survival reduces and the mortality is high. Then it has been seen that it is seen all over the global races, including Asian race, Americans, and etc. etc. But the mortality is very high in Americans, because they are the chances of cerebrovascular accident or the incidences are also very high. Hereditary, it is seen that there is obviously a family history of CVA, but at the same time there is also a past history of any kind of one or two transient ischemic attack. So what am I trying to tell you is, if a person comes to you that I had got a TIA, and if a person is above 60 years of age and person is already a diabetic or a hypertensive, or he is an obese individual along with smoking history and all, so that means I can tell you there are more than 30 to 40% chances that this person will again get another episode of either a TIA, or the person will get a full-blown stroke. So these are the risk factors which we need to sit and study. And when we are trying to understand the entire anamnesis of case taking in homeopathic angle, what we need to do is identify what are the causation. Causation is not only like ailments from grief, or person had something, or there was a shock, or there is a fear, or there is a fright. These are all psychological or emotional causes, but there are certain behavioral correction or lifestyle causation which needs to be addressed immediately, as it has been studied according to the World Stroke Organization or World Stroke Association, that if a person has got a TIA and these other factors there along with this, so the chances of another TIA or a full-blown stroke is very, very high, and it is almost as high as 30%. There are certain things which can be controlled, and as I have already mentioned, the blood pressure which needs to be controlled. Now, the earlier definition was anywhere the blood pressure more than 140/90 is considered as a hypertension, but nowadays it has to be kept much lower in range. It should be as low as 120/80. More you are going to manage the pressure and keep it on towards the normalcy, you reduce the chance of a stroke. So if a person comes with a blood pressure of 140/90, we should not be happy, but we should see to it we make all the efforts so that we can bring down to as low as 120/80. Diabetes, again, diabetes is one of the silent killer. It has been known that it enhances or accelerates the process of atherosclerosis. Here, time and again, I've been emphasizing on atherosclerosis or the changes which happen within the vessel, because the blood supply is something which needs to be preserved for the brain function to remain normal till the end of our life. So the vascular supply is something which needs to be studied very, very, very much in detail and carefully. Then something which is very, very common, and it is it's a self-induced hazard, that is cigarette smoking. The smoking is injurious to health. We all know it, but the smoking is really dangerous for the vascular pathologies, and it has been seen, and you also know it, that there are certain vascular phenomena, vasospasms and atherosclerotic changes which are induced because of the smoking. Then cholesterol, again, the cholesterol has a great role to play while the atherosclerotic plaque formation is taking place. So that's why the atherosclerosis and the cholesterol, they go hand in hand. We need to control the cholesterol level also, which requires immense dietary modification. Then obesity, I've already mentioned about the obesity. Then underlying heart diseases are there, and atrial fibrillation. You must have heard that there are certain strokes which are because the blood clot dislodged, and a small clot goes and sits somewhere in the vessel which is supplying the particular part of the brain, and suddenly that particular part of the brain gets ischemic, and the person develops the infarct in that particular area, and the person starts manifesting the various type of weakness of the limb, whether it is a motor weakness or there is a sensory loss. All these things can be there, and the cause is found in the heart. So the moral of the story and the take-home message is, when you're evaluating any brain pathology and any person who has landed up with a stroke, we need to even look at the heart, because there are certain thrombotic phenomena which may be present in the heart, and then the embolus is being dislodged from the heart and it goes and sits in the brain. So this thromboembolic phenomena, which is known as cardioembolic phenomena, is very crucial when we are trying to address a patient with a stroke. So immediately we need to advise a 2D echo evaluation, 2D echo, which is a sonography of the heart, which will show us the chamber and the various vegetations or the thrombus which has been present in the heart. So this is a cardioembolic phenomena which needs to be taken care of. Then there are ladies who have been on long-term oral contraceptive use. There again, the atherosclerotic process is enhanced and the person lands up with a CVA, cerebrovascular accident. Then inactivity. Then there is any vascular causations like hematological disorders like sickle cell diseases, where there is a sickling crisis, and when there is a sickling crisis, all the vessels get blocked because of the depositions of the clots, and the vital organs may get infarct, and and brain is one of the vital organ in sickle cell crisis. Then there's something called as carotid stenosis. This is very important. There are asymptomatic carotid stenosis which has been seen in patients, but we often miss it, because what happens is patient comes that I sometimes get giddy, sometimes I get a spinning episode, sometimes I feel I will lose my balance. But these are the warning signs or alarming sign. There may be a possibility of a carotid artery getting stenosed or narrowed, or there is a plaque formation in one of the artery, and that is a cause which is there, which is a warning sign. If we address it and on time, then there we can actually avoid a full-blown stroke or a full-blown ischemic episode in the brain. Then hypercoagulability. Hypercoagulability is another state where there are certain factors which are deficient, which breaks down the clotting factors in the blood, and at the same time there are certain drugs which can lead to hypercoagulable states. Plus there are certain hypercholesteremias or hyperlipidemias or what we say triglyceridemias, where the blood viscosity is very high and there are higher chances that there is hypercoagulability. So what happens is, when the blood is moving through the vascular channels, it has to have a appropriate viscosity. If the viscosity of the blood is very high, there are chances where the blood vessels, the RBCs or the blood cannot maneuver through this bed of capillaries and all, and there may be multiple infarcts which can happen because of the clotting of the blood. So that's the meaning of hypercoagulability, which I am trying to explain you in a very simple word, because the entire brain is actually supplied by mesh of the capillary bed, which is being bifurcated from the main arteries, starting from the circle of Willis. So that we will take it on later on. So now, up till now, we have to understand the word meaning of cerebrovascular accident. Why it is called as an accident? It is because the word accident means there is some major loss. The word accident means there is an emergency, and word accident means that we need to give the treatment immediately, so that the window period of the brain is salvaged. You have to salvage the brain or save the brain within the window period, that is around 3 hours. 3 hours is a window period. If you give proper treatment within first 3 hours of the onset of the stroke, the chances of recovery is very high, and there won't be any permanent disability. The target here is there should not be any permanent disability, because the brain is one organ which allows us to function fully, and it allows us to be oriented in the environment, plus take care of one's own well-being. If the brain is affected, the patient's ability to carry forward the normal routine activity is also lost. So that is what is the meaning of all. Okay, and the web of causation has to be, you may give a right simillimum, but if a patient is going outside your OPD and eating a lot of junk food, so your medicines are going to have a very limited scope, because he is not having a lifestyle modification. Similarly, if a patient goes out and he goes in outside Cooper and all this hospital, and then there are pan patti shops and they start smoking. So how is your medicine going to help? So that is what I am trying to say. The web of causation, and identifying this web of causation and correcting is very important.